Story time! Gather around the campfire. Sean's telling another story. So a little while back I told the story of why I became a nurse. It was a bit of an emotional story. I shared how I had become a patient for a short amount of time and my experience while I was in the hospital and the nurses that cared for me, and how particular experience as a patient with a particular nurse literally motivated me to apply to nursing school, and as they say, the rest is history. So I thought maybe I would tell the story, or at least give you the information of why I became an acute care nurse practitioner, why I decided to become an NP. It's not nearly as emotionally driven, but still nonetheless I think it's pretty important, because a lot of the tribe continually asks if becoming a nurse practitioner is the right move for them. Is it the right career choice? And quite honestly, the answer is you literally have to do your own self-assessment. You got to have the self-awareness, and you have to do a lot of digging and a lot of research to decide if becoming an NP and what kind of an NP you would like to become. A long time ago, I was a baby nurse, and I got hired into a small ICU. When I started working there, I was exposed to the traditional setting of, it was a small hospital. There weren't, to my knowledge, there were not any nurse practitioners, at least none that I saw in the ICU. Now you got to remember, this was almost 15 years ago. And I had little to zero exposure to an advanced practice provider. I don't remember ever, I take it back, I met a physician assistant, but he worked in the operating room. So he worked in orthopedics. He ended up being a good friend of mine for quite a number of years. But I don't remember off the top of my head any nurse practitioners during that first year or so, because I stayed in that hospital system and in that ICU for about a year before there were some personal issues that come up, and made a lateral move, and then eventually ended up in a level 1 trauma, huge teaching center as a less than 2 years of experience ICU nurse. Still green behind the ears. I was just getting confident in my skills to the point where I was dangerously cocky, and my eyes were surprised to see just how sick patients could really get. That's when I truly learned the craft of ICU nursing, was in that trauma center. And it was absolutely freaking amazing. I can remember vividly in the first half year that I was there, probably, actually I would say within the first couple weeks to a month, was on a night shift, was working, I think I might have been on orientation or not, I don't remember, it's been so long, and I had a patient who ended up decompensating, they're crumping, and they called in the CCM, that's what they called them. Call CCM, which is critical care medicine, which is someone who's in critical care. And at that time, my knowledge was CCM equals doctor. CCM equals the resident. CCM equals the fellow. CCM meaned a physician of some rank. And they called in the CCM, and it was a woman. Her name was Tina. Tina come in, and she just was like a whirlwind of information. Did this, do this, we need to start this. She ended up doing a couple procedures. I think she did a central line, an A line. She might have even bronked somebody. I don't know if this all happened on the same night, because it all blur 15 years later. But she was in, she was out. My patient got better, or they didn't get worse. is the ICU, so grain of salt. And after they were done, I remember having to document something, and I asked my preceptor or one of my coworkers, what was that doctor's name? Hey, Joe, the doc that just came into room 7, what's her last name? I saw her, she said her name was Tina, but what was her last name? Yeah, that wasn't a doctor, Sean. That was Tina, the nurse practitioner. Say what? Yeah, that was my first exposure to what a nurse practitioner could do. Was completely blown away at the idea that what I just saw was performed by an advanced practice nurse. Not a physician, a nurse. Like, it was hard to connect the dots. Because what she was doing was pretty advanced. And in my experience at that time, I was just like, wait a minute. How did she know that stuff and do that stuff? Remember, my exposure was minimal at the time. Years went by, I ended up becoming very good friends with Tina. And I left that unit several years later, went on to a smaller hospital, ICU, blah, blah, blah. I went and got my bachelor's, and it never left the back of my brain that what she was doing was the coolest thing known to man. And she was super smart, like, super smart. Like, did I mention smart? Kind of smart. And I was blown away at not only her skills and her knowledge, but the way that she managed a room, the way that the rapport that she had with the nursing staff, the rapport that she had with other providers, other team members, CCM, the way she talked to the surgeons, how she was able to manage everything. Like when we had admissions, it was Tina. Tina would come in, assess the situation, spit off the orders, put in the orders. If something needs to be performed, she would do it. And anything that happened during that shift, and in this particular case, Tina worked straight nights. And if anything happened on the night shift, Tina was the person you went to. Tina was managing it all. She was the one that was the primary educator for all of the residents and fellows that would come through. Like when they needed something, they asked Tina, what should they do? She was bad. We're not going to use the language I want to use because, YouTube. But she was bad. So, when I graduated with my BSN, I had been a nurse for 5+ years. And in the ICU, the natural progression for most of the guys that I knew were to become CRNAs. Or you had this remote idea of becoming a nurse practitioner, even though, I didn't see it a lot. Since I left that facility, I hadn't seen anyone like Tina. So, I didn't want to be just an educator. And not that there's anything wrong with education. It just wasn't what I wanted to primarily do. I want to continue to teach, but I want other options. I love being at the bedside. I love seeing the minute-to-minute progression of patients. I just love the ICU. I think we've talked about this. I thought the only thing I could do was to shadow a CRNA, because my exposure for a CRNA up to that point was I communicated with them all the time when they brought patients to the ICU, pre-op, post-op, talked to them all the time about what was going on. I had really good rapport with CRNAs as well as the anesthesiologist, so I shadowed someone for a shift. And I didn't last yet maybe a couple hours. I didn't last. Like, I thought that the CRNA job was, like, go, 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 excitement, non-stop, boom, boom, boom. You're always just saving lives left and right. And it's not that. I mean, they get paid for their education and training, which is a very high level, but it's very specialized. And the best description I had from an anesthesiologist once was that he got paid. He was trained for the 10% of his job. 10% of the time, patients went south. and he had to utilize his advanced training and education. And the CRNAs were kind of the same thing. The 10% of your day is when you're going to have to pucker up and save lives. I also didn't like the process or the tempo of the day. It was a lot of pre-op surgery, post-op, and you're just churning people over left and right. And it was it just wasn't me. I mean, I knew by the time I left that shadowing experience, yep, nope, not for me. So I kept going back to the advanced practice role of the nurse practitioner, and called a couple people, had some conversations with people, and that summer I graduated with my BSM in the spring. Within several weeks into the summer, I had applied and had gotten accepted into the acute care nurse practitioner program a couple counties away, and the rest, they say, is history. So Tina is the reason why I became a nurse practitioner, and I'll be going into my 8th year as an acute care nurse practitioner, and I couldn't be happier. I absolutely love where my career has taken me. I'm back in school to finish my doctorate, to get my DNP. If I have any regrets, it would have been I probably should have started with that, but at the time of my life, it just wasn't possible. A couple caveats is that it always was the acute care route for me. That was not a negotiation. It was always wanting to work in the ICU. I didn't want to, but if I had to, I could work somewhere other than a large teaching facility. But I wanted to be Tina. I wanted Tina's job. And 7 years later, I have it. I've had it for the past 7 years. I'm that person. And it is absolutely awesome to think that all those years ago, when I first saw what Tina could do, that I had a vision, I had a desire, I had a goal. And while it took me several years to realize it and to follow through with those plans, here I am, almost 15 years in this profession, and just shy of half of that time, I've been a nurse practitioner. And it has been a wild ride. My only hope is that somewhere, somehow, some way, someday, that maybe I can do for someone else what Tina did for me.